Welcome to the March 2015 Kaweah Delta Newsreel. This month we'll see how Kaweah Delta is making improvements in neurological surgery and cardiac surgery. But first, here's news from the Family Medicine Center.
The Kaweah Delta Family Medicine Center is a brand new state-of-the-art facility located downtown, adjacent to the hospital. It was built to address the dramatic shortage of primary care physicians in this community. And it was built to improve access for our patients so that they can access high-quality, evidence-based medical care within their own community. We service the entire population, all ages. We take any insurance, and we even help the uninsured get insurance if they need that. The services we provide here at the Family Medicine Center are essentially any human condition or complaint that anyone may have, no matter what age they are, whether they are a newborn, whether they are a geriatric or older patient. We are here to give you the time that you need to address any medical concern you may have that is not a true emergency. The Kaweah Delta Family Medicine Center benefits the community in that it trains physicians in this location who are supervised by physicians who have been in this community and are rooted in this community and familiar with this community and its cultural diversity for decades. Thereafter, once the residents have completed their training here, we have specifically recruited residents and physicians that will stay in the community and continue to provide for this population and become bonded to those patients long term. It is not just a 3-year commitment to a physician and then they will disappear. These physicians are committed to this community and wish to stay here. We also have a tremendous number of Spanish-speaking physicians here, and all of our staff are fluent in Spanish.
The new neurological surgery program here at Kaweah Delta will bring a host of new services to the community. We are a part of UCSF Fresno. All of our doctors that will be here at Kaweah Delta will be board-certified neurosurgeons, and the majority of them are fellowship-trained neurosurgeons. We will offer a broad variety of neurosurgical care that will include brain tumor surgery, spinal surgery, as well as trauma surgery. The trauma surgery is probably what is most important for the families and community members in this region. Right now, if you have a subdural hematoma or an epidural hematoma, those patients often can die quickly and they have to be transported hours away. But now those services will be offered here at Kaweah Delta Hospital. The new neurosurgical program here at Kaweah Delta will offer several benefits to the community. Along with us being fellowship-trained spine surgeons as well as fellowship-trained brain tumor surgeons, there are other ancillary services that will be offered that were not previously offered to the members of the community. And what that really means is that patients are going to be able to stay here in the community and have their ailments treated if indeed they need a neurosurgeon. The new neurosurgery program here at Kaweah Delta will serve primarily the members of the community in the Visalia area, as well as members of the community in Tulare County, as well as the Kings County area. The new neurosurgical program here at Kaweah Delta will make a change in the lives of people here in this community. Currently, when you have a stroke, a cerebrovascular accident, oftentimes you're left with a devastating injury. But now we are teaming with the neurosurgeons at UCSF Fresno to change that. We have endovascular surgeons that are readily on hand to help and treat strokes as well as vascular malformations. I believe that will be an asset to the Kaweah Delta neurosurgical program.
I've been recruited by the hospital to introduce contemporary surgical techniques for the management of valvular heart disease. Minimally invasive heart surgery is done with small incisions in the chest wall on the right-hand side between the ribs In the case of aortic valve surgery, a small incision about 3 or 4 inches long is made between the second and third ribs to the right of the sternum, and this avoids the use of the median sternotomy, where the breastbone is sawed in half and has to be put back together again. The benefits of these incisions are that there's much less bleeding involved. Patients cannot have any sternal complications since the sternum has not been invaded. And finally, the ability to recover more quickly, to be up and around immediately after surgery, and to be discharged from the hospital earlier is seen with these operations. Well, the benefit to the community in general is that people won't have to travel far from their homes and their families in order to have the most contemporary surgical management for their valvular heart disease. And of course, therefore, they will have easy follow-up by physicians who are also local here in the community, who have known them both before, during, and after their surgical experience.
And that's the newsreel for this month. Thanks for watching, and we'll see you next month.